I'm Eleanor Newton. I was born in Manitowoc, Wisconsin, and I went to school in Chicago at DePaul University and St. Joe's School of Nursing during the Cadet Nurse Corps during World War II, and intended to go into the Army at that time, but the war ended and they weren't taking any more nurses, so I went on into polio nursing, and then after that I went with communicable diseases and went to Chicago, and then from Chicago I went to California, worked there in polio nursing, then I went into pediatric nursing, and then I went into, took a postgraduate course in OR, and I worked working as a surgical nurse. And my field mostly was orthopedics and cardiac surgery had just started then too. And then I went to Santa Monica, California, and worked in Santa Monica in the surgical ward at Santa Monica Hospital. And then they had an opening at the VA hospital, so I went to work at the VA hospital, and I was working there as a surgical nurse, and then I went in to the surgical department again. And then I decided to join the Air Force. I went to the VA. I was working in the VA as a surgical nurse, and then I tried to, I decided the Korean War had broken out and they were wanting nurses, and I looked at the Navy and decided, no, I'll go ahead and join the Air Force. Somehow or another, I always wanted to be an Air Force flight nurse. That was my love. And so I sent in my application. I never did go to a recruiting station. I don't know why I didn't do that. I mean, there must have been some reason there or something. But anyhow, I contacted D.C. and went directly through Washington, D.C. And then I had a little bit of problem getting into the Air Force, and finally, after the Army decided, the VA decided they would release me for the Air Force, and I think it was because Michaels was an Army nurse, ex-Army nurse too. I think it was prejudice there. Well, anyhow, I did finally get into the Air Force. I reported at Edwards Air Force Base. And then after I was there, I think I'm the one that put the bug into the ear of everybody, because after I had met Captain and told her I wanted to join went to my chief nurse, told her I wanted to become a flight nurse, then everybody started looking into it and everybody started applying for it. And I thought, well, geez, here I did apply, mentioned it in 50, and here I didn't get a chance to go until 51. But I did go to flight nurses training. And after that, I was stationed at Edwards Air Force Base just, I think, 2 months, and I received orders. After I'd gone to school, I received orders to go to Mobile, Alabama. So I reported in Mobile, Alabama, and was assigned squadron there. And we flew patients of all types, stateside, war vets, World War II, Korean War, and sometimes civilians. Up and down the East Coast, we flew to San Juan, Puerto Rico, Puerto Rico Air Force Base, the islands, and transported them across the United States, and emergency patients too, and sometimes we would fly into Denver and San Antonio too, and pick up patients that came from Korea to their nearest hospital. And back in 1952, I met my husband, and we were married several months later. And the reason why we got married then, we weren't supposed to get married until later on that year, but he found out that my chief nurse was going to send me to Japan, and I was enthralled with it. I did not know about this until after we were married. And we had moved our wedding date up and had gotten married then, December of '52. And then we would fly, I would fly one way and he would fly in the 124 and fly another way. I would go south to South America to Panama Canal or someplace like that with my patients, and he would take off and go to Thule or someplace over in Europe or in Korea or someplace like that. And we'd come in and just sort of, I'd meet him and he'd meet me at the airplane and greet me, and I'd say, well, hi, how are you? And he'd say, well, I'm fine, but I'm leaving on another flight. We communicated sometimes only through telephone or by radio. But anyhow, I discovered I was pregnant in January, I think it was. No, February. And so then I wanted to stay in. I had written and requested to stay in the military and everything like that. And they said, no, that they were discharging you if you were pregnant, that it would be later on in date, something like that. But I didn't, I had to resign. Well, I decided to resign in June, I guess it was June of that year, because I was having trouble with my pregnancy. And then I followed my husband around after that. I had gotten myself a job in the local hospital in the OBGYN department, and I worked there. And my husband, in the meantime, had been sent to Iceland, and I was going to go with him, but I was having trouble with the pregnancy at the time, so I couldn't go. And when he came back, we were stationed here in El Paso at the Air Force Base, SAC. And my husband was flew the 124 and was involved with the POWERS program. I don't know if you heard about that. It was over in Russia when he crashed his plane and everything. But after that, we went to Biloxi, Mississippi, and then from there we went to Moses Lake, Washington. And each place we would go, I'd either volunteer or I'd get myself a job as a nurse working in the hospital. And then we went to Libya, and while in Libya I worked with the Dr. Desport's wife, and I went out amongst the Arab community, giving the polio sugar cube to the patients, to the little children, and treating their eye problems. And then from there we went to Wiesbaden, Germany. I did not work there. I enjoyed Germany and traveled around Europe. And then we went to Langley Field, Virginia, where I worked and did a lot of social work there too, and worked with the there was a society of local personnel there. Then we went to, from Langley, we went to Washington State. And there I was a Girl Scout camp nurse and worked with the Girl Scouts a lot, and then also worked in the hospital volunteering. And then we went to, and raising my two daughters. And then we went to Frankfurt, Germany. And that's where I almost went back into the military in Washington. And I also was in the Civil Air Patrol in Washington State. Forgot about that. And then we went to Frankfurt, Germany, and there I traveled and helped my daughters around a lot and helped my husband in the military. I had a lot of extra duties that I had to take care of. And we opened up in the terminal, I worked with the women, and we opened up a nursery and a place for when the people would come into the terminal, they would have some place to go take care of their babies and everybody. And got that all set up. And then we went to Altus, Oklahoma, where I worked as a ER supervisor, a night supervisor and ER nurse, also an evening nurse. And I worked there for 3 years. And then went to Ruidoso, New Mexico. And then I worked in the hospital there. And I also then I got interested in working as a racetrack nurse. And that was rather interesting. And also they had a movie they were putting on at that time, Casey's Shadow, and they needed a nurse on the set. So I worked with the movie people too, and as set up a first aid station for them also. And then went to El Paso. We retired in El Paso, Texas, and that's when I got myself a job at Hotel Dieu as an orthopedic nurse. And then my husband and I would travel in between. And then I got myself a job as a school nurse, where I worked there. Then after that, my husband passed away, and I stayed on as school nursing. Helped set up the Society of Military Widows that we have here, organization. And I've joined a lot of organizations, been very active with MOA and NOS and Society of Air Force Nurses and American Red Cross, volunteering in the hospital too, in the emergency room for 21 years. And then I keep busy. Don't let anything get on grass grow underneath my feet. During 1942, I went into nurses training and joined the Cadet Nurse Corps with the intention of going into the World War II as a nurse. And this was what our uniform was like. I mean, this was what we were like, and this is what the colors of our uniform at the time. And I spent 3 years in cadet nursing, and then when World War II ended, they weren't taking any more nurses, so I went to polio nursing. And then this was my husband and I, our wedding picture. Unfortunately, I don't have any other pictures. All the rest of them burned in a warehouse fire. But this was me and my husband. He was in World War II, Korea, Vietnam, Dominican Republic, the Berlin airlift too, after 35 years of military service. And I followed him around after we had gotten married.
What military unit were you a part of?
Well, the first time I was at Edwards Air Force Base Hospital. And then when I went to Gunther, Alabama, to the AirVac school. It was called the Air University, and I was stationed there for 6 weeks. And then I went back to Edwards Air Force Base and received orders to report to Brookley Air Force Base, where I then became, did flight nurse, my duties were as a flight nurse. And we would go to the hospital and check out the patients and load them onto our aircraft and take them to the various areas. Many of them were Korean vets that were brought stateside to be transported to a military hospital nearest their home base. And we would check them out and take them to various areas.
Did you ever actually go to Korea?
No, I applied for it several times. Every time I applied for it, they sent me to the East Coast, and that's where I ended up. And believe it or not, after I had left the military, I stayed with my husband, and we traveled. Every time we'd apply for, like we applied for Hawaii, we ended up in Libya. When we were in Libya, we applied for Japan, and we ended up in Wiesbaden, Germany. No, in Germany. It was always just the opposite of what we applied for. Somehow or another, I think the government said, well, if you want to go there, we're going to send you on the opposite shore.
So where were you stationed?
My first station was Edwards Air Force Base, Air Research and Development Base, and we were at the hospital there. And I was a surgical nurse there, and that's where I applied for flight nurse training. And then they sent me to Alabama to the flight nurse school there. Flight nurse, where we studied. We were trained in medicine. Then when we went to school, we studied aviation medicine. And that was in Maxwell Air Force Base.
And what does that look like? What is the training for flight specifically?
Well, as I said in that article that I have there, they have everything in there what we did. First of all, we studied aviation medicine. Then we had a regular aircraft in the lagoon there, and we had to know ditching. We went through the entire mimic of ditching. And we had to know how to rescue patients if need be. And we had to be able to take care of patients in flight. We had to be able to diagnose whether the patient was getting, let's see, what am I trying to say here? If the patient needed more help, if we needed to land, and we would tell the pilot what altitude we could go to at that time, because our aircraft were not pressurized at the time. And we had to tell them, if the altitude was too high, or if we had to request them to come down in altitude, or if the patient, we could tell the doctor if the patient was not able to fly.
Can you describe what ditching means?
Ditching is perchance the plane develops engine problem or something and has to land in a lagoon in water, in the ocean. And we would have to be able to take the patients out of the aircraft and make sure that the patient was safe and put them in one of the boats, the lagoons or whatever. But we'd have to put them safely in there until somebody could come to rescue us. And that patient would be intact and not be injured in any way. And we had to be able to rescue the patient and take care of them during the time of rescue from another aircraft or boat at the time. Or if we were had to land in a desert area, if the plane had to come down and we had to take the patient out of the aircraft, we would have to be able to do that, and within a short time. As you know, your time is limited many times when an aircraft crashes. But that didn't happen very often. But we had to be prepared for this.
Were you ever in a situation where you had to use that training?
I've had to request landing at the nearest hospital because a patient had become acutely ill and we needed to get the patient to a better facility than what we had on the aircraft. And yes, we've had emergencies like that. We would have to go. Sometimes there was a terrible accident, so they would request an aircraft, and the patient had to be transported to a base hospital, military hospital, of some nearest military hospital, so they would request an aircraft. So we would, that's when I flew in the C-47, which is a smaller type of a regular prop aircraft. And we would fly to the area, pick up the patient, and nurse the patient as best as we could until we got to the nearest airport and offload him to the nearest hospital. Sometimes when we were stateside, the military hospital was out too far away from an airport, but they had these small airports, and we used to have to call in, would you please get the cattle off the field? We are coming in as emergency aircraft to meet the ambulance below that to transport a patient to a hospital, and that's what we would do.
What was your specialty?
My specialty was operating room, surgical nurse. When I was flying aerovac, flight nursing. Aeromedicine is what they called it. It's changed now 100%. When we had to give IVs at altitude, it was a lot different than it is now because the aircraft was not pressurized. And taking blood pressures was entirely different. Depending upon the patient as to their oxygen level, we had to watch that very closely on some patients too. It was entirely different than it is now when is flying patients to and from various areas. As you know, some patients have to have oxygen in flight and some do not.
So can you tell me about your time during the Korean War? Where were you stationed? What was your duties?
Oh, I took care of the military personnel, and I worked in the hospital, and I helped transport and take care of patients. And we had extra duties too that we would do with civilian personnel. So we had a couple of aircraft that were had crashed, and we had to take care of their dependents and see that they were taken care of. And sometimes we had to go out to some crash sites and assist. We had an earthquake in Tehachapi during that time, too. We had to go and help with the earthquake victims when I was at Edwards Air Force Base. At Brookley, we were on call 24 hours around the clock, 7 days a week. And if they had an emergency somewhere that they needed us to go and pick up some patients and transport them to the nearest hospital or the nearest facility to take care of the certain injuries. Say, perchance there was a severe head injury, we had to take them to the facility that specialized in taking care of brain cases or spine injuries or anything like that. And we had to be very careful in transporting these patients. And sometimes we had to give blood transfusions on plane. It was very difficult at that time to keep the blood flowing as we transport the patient around, and keep the patient calm and let them know that they were going to be all right. And we also transported many PTSD patients too. And many were there very anxious, and we had to assure them that they would be all right. Many of them that we got back from Korea at that time.
Those that you would pick up who had served in Korea, where would you pick them up from?
They would transport them back to the stateside, and they would bring them into Travis. They would bring them into McCord Air Force Base, or they would, oh heck, I forget the name of the base down in Southern California too. And then we would come in with our aircraft, and we would unload them onto our aircraft and then transport them to the various areas that they needed to go. Some needed to go for certain treatment at a certain hospital, or they had to be transported to a certain place where they had specialty training there for them. And or sometimes just to get them near a hospital near their home so they could be near family.
Are there any specific stories that you remember from that time?
I had a patient that I had argued with them, the doctor, that I did not think he should come on board the plane. He was on a stretcher, and I told them that I did not think the patient should be coming on board, and they kept on insisting, and so I had gotten a direct order to take the patient on board the aircraft. And I told him I did not want the patient or take the patient on board the aircraft, that he was over-sedated, and that he needed to be in the hospital area where he could get immediate care. And it took a long time to convince the doctor that no, the patient was not there. And so I left the patient there, and it was a good thing I did, because I understand the patient did die. after that, and that was a very sad situation. But I was right, and we were trained if we needed to override a doctor, a physician, that we could. And it took a lot of insistence that this had to be done. And another time, I had a patient on board the aircraft, and he was fine and talking and everything. But then all of a sudden, while in flight, he had become very acutely ill. And no matter what we did, we had to request immediate landing. I kind of chuckle sometimes about it, because that was when I told you sometimes we have to request to have them. It's a field. This was in a C-47 at the time, and it was a field where all they had was a tower. You could call into the tower. But you looked down and you saw cattle running around the field, and we had to tell them, please chase the cattle off the field so we can come in and land. And then as we landed, the ambulance had come to take the patient to the hospital. It was a good thing we had sent the patient back to the hospital, to the other hospital. I mean, fortunately, we found a hospital and we had to land. And I remember it was raining that day, and it was very stormy too. But we did get the aircraft down safely and get the patient safely to the hospital. That was one other time. Then another time, I was taking a patient that was in a respirator, and we had to, somehow or another, the respirator stopped contracting, and the patient wasn't doing good, and we had to hand pump the respirator, and then finally we finally got it going a little bit, and we did. It was over water, and it was kind of a hairy time flying over the ocean at the time, and have a patient go bad with the respirator also go back bad. But we did finally get the thing going and everything. Thank God for good mechanics on the airplane. That's all that I can say. But there are just a few of them.
So why did you choose to go into the nursing in the Air Force?
It's just sort of something that I always wanted to do, and I always wanted to go overseas to a war zone area so I could be there and help these patients, help these GIs, and do something. It was just a caring that you have within yourself. And you think, well, this, I've always liked something that was, that kept you interested and wanting to do something that was a little bit above normal. That's the reason why I preferred emergency room or operating room. And I did like nursing, bedside nursing too. But by then, the patient is well on their way when they're doing bedside nursing, on their way to being well. I just wanted to help get them well. I want to correct what was the matter with the body to help the individual. It was a caring thing. And Air Force, well, I think if I went into the Army, I'd feel the same way. Or if I went into the Navy, which my daughter did go into the Navy. So it's the caring, nurturing part of me that wanted to do it. It just kind of appealed to me.
Are there any particular friends that you remember?
Oh, yes.
Can you tell me about some of these people?
Captain Kaufman was a very interesting person. She was my chief nurse. When I reported into Edwards Air Force Base, I met this lady going into the, putting things in her car, and I told her I was looking for the chief nurse to report on duty. And she said, well, I'm the chief nurse, but I'm leaving now. If you go inside, you'll find Captain Coffin. She's got a dog. She's going to be acting chief nurse and eventually be chief nurse at the time. So that's how I got in there. And one thing that was real funny, when I reported in, I had to be sworn in by the adjutant, and I told them I was Lieutenant Morotic reporting for duty, and they said, we have no Morotic here. And I said, well, here are my orders. And he looked at me and he said, oh. He said, we have a neurotic here. Do you think that might be you? And believe it or not, it was. So, needless to say, my indoctrination into the Air Force was very odd. They never did send me to training of any sort. I never got any indoctrination into the Air Force until I went to flight nurses training. Did I find out about some rules and regulations that you have to follow. I first tried to get into the Air Force, and the VA refused to release me. So I had gone down to the Michaels, the chief nurse, and informed her of this and told her I wanted to join the military. And she said, well, I will get you in the Army. And so I said, okay. So I filled out the paperwork and sent it in. Completely forgotten about it, and I had, in the meantime, written back to D.C. and informed him that they will release me to join the Army. Why will they not release me for the Air Force? So the Air Force, 2 weeks later, sent me a commission of first lieutenant, and that's how I got into the Air Force. I'd completely forgotten about the Army application, and 3 months later, I had been in the Air Force. I was working in the hospital, and Colonel Knapp called me, and I went to see Colonel Knapp, that's what it was, and I told him I had received this letter for a commission as captain in the Army. How do I take care of this? And he said, well, if you'll just give me that letter. And he said, we've got you now. And he tore the letter up, and he said, forget about it. So that's how I got into the Air Force. Then I got letters to report to Edwards Air Force Base, and that was it.
What is one of the most memorable experiences that you had during your service?
Oh boy, let me think. I've had many. I think the one when I had gone down to on C-54, I think it was, to San Juan, Puerto Rico, and I was to pick up patients there to fly them back to the United States to various bases where they were, I think, it's Denver, San Antonio, various places. But when I had gone down to the emergency room, they had requested me to come back through Puerto Rico because our aircraft had developed engine problem. And I had gone to the emergency room to pick up my patients, get the report on all my patients, and make arrangements to pick them up in an ambulance and then drive down to Puerto Rico to unload the patients on a 124. And in the meantime, the nurse that came out to meet me was a friend of mine that I did not know had joined the Army from Santa Monica, California. And she was there, and we were both very happy to see each other. She was surprised I had joined the Air Force, and I was surprised she had joined the Army. Neither one of us had ever mentioned any of it in our association in Santa Monica. And then the trip between San Juan and Puerto Rico was very interesting, very scary. The roads were, it seemed like they were just itty-bitty narrow roads. And that's when I found out that pineapples grew out of the ground. I don't know why, I always thought pineapples grew from trees. But then we flew back to, from Puerto Rico to Mobile. No, first we went to Florida and then on down. But I'll never forget, we had hit a terrible storm. And my poor patients were so petrified, and I had a respirator patient on board, a patient that was in a respirator too that I had to take care of. And I had a lady who was going into labor, and I prayed she would wait and have that baby when we got to Florida. And I went through this time when she was in labor, taking care of her, taking care of my respirator case, and then I had 3 litter cases on board too. Poor patients were petrified, and several other ambulatory patients on board. I guess that's one of the most memorable times that we had. Needless to say, we were fortunate. We got to Florida in Miami. We landed and offloaded my dependent who was pregnant. And I guess she had the baby shortly after she had gotten to the hospital. I almost had to deliver the baby in the aircraft. But I think I'll always remember that. And needless to say, when we had when the 124, when there was a shaking of that airplane, it was really something.
What was your date of military discharge?
June 1953. I had gotten married in the meantime at Mobile, Alabama. And, well, when you get married, things do happen, and I had gotten pregnant. At the time, you could not stay in the military if you were pregnant. Prior to that, if you were married. But now it was if you were pregnant. And I had gotten pregnant, and I tried to stay in, and they said no. It was only 3 years later that they allowed any female to stay in the military if they wished to when they were pregnant. And unfortunately, that's what happened. Then I was back in 1960s sometime. I forget when it was, when we were stationed at McChord Air Force Base, when I was followed my husband then. I almost went back into the military to go to Vietnam. But my husband was going to Europe, and I would have gone to Vietnam. And I said, no, I'll just go ahead and go back, stay out. So I never did go back in.
What did you do after returning from your time?
In the military?
Mm-hmm.
I volunteered in the hospital. Then I went back to, years later, I went back to nursing, and I was working in orthopedics, in an orthopedic ward. Then after that, I went into school nursing, and I was a school nurse. And in 1985, I finally quit nursing. But in the meantime, I had also volunteered in the emergency room, and I did volunteer work for 21 years in the emergency room.
What does that look like?
taking care of patients' emergencies when they came in. I would hook them up to monitors, and I would report to the nurse if there was any unusual things that were going on with some of the patients. I would admit patients. Many of the patients that were just not acutely ill, I could admit them and then get them ready for the nurse on duty to take care of the patient. I would take the patients to the various areas if they needed to go to X-ray or various areas in the hospital. I would do a lot of filing. Just about everything, with the exception of actual care for the patient, because as time went on, there was strictly people who were actually working in the hospital, and we assisted them towards the end.
Are you involved with the KWVA, or what is your current chapter?
I'm involved with the VIST program, and that's vision of people who are blind, and that's about it. I am involved with the Society of Air Force Nurses. We meet every 2 years and then keep in contact. Then we also have district areas. My district is San Antonio. That's the southwest region. And we are all over the United States. It's an association of nurses who are active duty and also those who have retired from the military.
Is there anything else that I haven't asked that you wanted to share?
There's a certain camaraderie in the Air Force that is there. No matter who you are, you're always caring for somebody. And I'm sure it's the same thing. My daughter said the same thing about the Navy, too. So it's, irregardless, when you're in the service, somehow or another, there's a caring aspect there that we have, just a camaraderie that always stays with you, memories that never go away.